70%. In accordance with the Universities Act number 42 of 2012.
On this wonderful day, dear graduation, we celebrate today and move towards our future.
We would like to bridge this gap.
Today, we come together to honor the incredible accomplishments of 266 graduates who have successfully completed their studies in various fields, including nursing, reproductive health, critical care nursing, mental health practice, community health practice, physiotherapy, midwifery, health systems management and development, health professions education, and public health. As we acknowledge the graduates' accomplishments, it is important that we reflect on the pressing human resource for health gaps faced by our nation. Kenya, like many other countries, and my sister Chiponda is here, we experience a shortage of health workers, and particularly in rural areas where access to healthcare is limited. This scarcity hinders access to quality healthcare, perpetuating disparities and limiting the delivery of essential services. This imbalance leads to a scarcity of healthcare professionals in rural regions, creating barriers to essential services, exacerbating health disparities. It is imperative that we strive for a balanced distribution of health workers to bridge this gap and provide equal opportunities for healthcare across our nation. We have already taken significant steps to address these challenges and improve the health workforce in our nation. Only last month, and part of the first few days of this month, as a ministry, we managed to post over 4,000 interns. Firstly, we are investing in the training and education of health workers. In the budget that begins this month, we have increased funding for health schools and training programs, providing more opportunities for aspiring healthcare professionals. Additionally, we have implemented scholarships and financial assistance programs to ensure that talented individuals can pursue their dreams of serving in the healthcare sector. Secondly, we are working to attract and retain health workers in rural areas through collaborations with the county governments.
Health is a global issue. Pandemics know no borders. Health problems know no borders. And that is why even health policy is developed at global level and implemented locally. We believe that health workers must think globally, that in their training they must be exposed to problems of health across borders. And that is why we work with colleagues across borders. Many of you have had lectures by colleagues from Southern Africa, from West, East, from Northern countries, and so on. And the idea is to get that exposure. And so again, today I want to believe that you will think globally, even as you act locally. We want you to go out there and speak that language of equity, of justice in access to healthcare at all levels, but specifically at primary healthcare level, where most of our populations go. Our training is not just theoretical. Of course, we are a university and we have to profess theories, but we connect that theory to reality, and it is the reality that we have seen over the last 67 years or so as Amref. And we believe that by combining theory and reality in our training, our graduates come out ready and fit for the African market. They don't have to retrain to be able to provide services in their areas of expertise when they go out there.
One of the most beautiful things about advanced diploma in mental health is practical based. Meaning students, they do a lot of practicals, and they are also taught by psychiatrists and they are taught by psychologists. In that, they are given opportunities to do something called case presentations, and they are helped by the psychiatrists and the psychologists to know how best to come up with the treatment plans for their patients. So they apply this. Much of what they do in class is what they go and apply in their day-to-day living. Every other person I would advocate, they do advanced diploma in mental health. Reason being, it is practical oriented. Number two, the teachers are experienced. They are psychiatrists and they are psychologists. Now, with the psychiatrists and the psychologists on board, then they have more opportunities of doing practicals under the supervision of seasoned teachers or lecturers that will make them be better even as they move on with life. Many places where we have counseling psychology, especially at the diploma level, they might not have the practical aspect as much as we are having it at Adams, Advanced Diploma in Mental Health Practice.
Our government has enough mental health professionals in Kenya. And indeed, we didn't hear from the Minister of Health, Dr. Nakhumicha, that Kenya as a country has limited healthcare professionals, and particularly in the area of mental health, where we have very limited psychiatrists, limited counseling psychologists, and also limited clinical psychologists.
We need more workforce. Realizing that in my service, that is Administration Police Service, we have 72 counseling psychologists. And currently we are deploying, we are designating 14 to be able to take care of the regions, counties, and the regional units and colleges, so that they can be able not to mainstream the services down to the lower levels. So we need that. But again, I also wanted to appreciate my service, that is for allowing me. That is the Inspector General Police and the Inspector General Administration Police for giving me this opportunity, and my colleague, because we are two, to be able to take this service.
Because I thought I knew everything when I graduated with my PhD, until I started running a mental health facility, because I'm a director at a Nobility House Rehabilitation Center, until when the patients started coming in and they were being diagnosed with mental illnesses like schizophrenia, bipolar, anxiety, and other, mental health disorders. And I felt that I had a gap. I knew about counseling, I knew about therapy, but when it comes to the real mental illnesses, I felt that I had a gap. And when I came into contact with this program, it is called Applied Diploma in Mental Health Practice. I was attracted by the word practice because it is not about what I know. It is about moving a patient from point A to B.
Being a mental health provider in general is a calling, because you get to, being a mental health provider is a calling because you get to experience an in-depth part of an individual's lives, the intimate parts of them, and you're dealing with people's lives. So I do emphasize that this is not just a job, an 8 to 5 job. It's something that we live and breathe every day of our lives.